Thank you very much. It is a great pleasure. The title of my talk was very long, and when I tried to give the talk, I said I have to make it how to go further. Which one? I'm pressing everything, not moving.
AI.
I'm pressing all. I pressed, not moving. Calculate the time. Don't tell me 10 minutes. It is not moving. It's not moving, the slide. Now it's moved. Okay. Yes? It's okay now. Okay. So the objective was very difficult for me. Understand why hypertension as a number one killer. Yes, we'll show it to you. Understand the magnitude. Yes. Understand the new recommendation. Okay. And then understand the obstacles of implementing, and then how to overcome the obstacle. This was the title of my talk, so it's very difficult. So to go to one by one, impact of high blood pressure, just if you see here, you will find that it is number one killer. So now we understand this. Number two is, it is well controlled. The answer is not. We'll find that only minority of the patient controlled. Unawareness, awareness but not treated but not controlled, and then the people controlled is only less than 25%. The second thing is this is in Europe, it is in Middle East. Actually, it is in Europe, the same. And if you look to England, you will find only 21% are controlled, which means 80% are not controlled. If you go to the United Arab Emirates, for example, you will find that only 25% are controlled, which means 75% are not controlled. The question is why? Because hypertension is asymptomatic. I have done a study in Abu Dhabi for locals, and we find after 1 year, only 75% of them only 25% taking the medication, 75% stop. The question was why you stop? He say, I'm not complaining, and I don't want to be used to the drug. He feels that if we give the drug, we cannot stop. I told him, no, I want you to be used to the drug. So now we'll go to the hypertension lead to increased risk from stroke. And if you look here to the number, you will find that if I have 120 over 80, different. 140, it is double. If you remember that the guideline was confusing us, as I will show you, 160 and then 100, you will find that it is increasing the number. Now we'll go to the United States, for example. You find most of the people are falling in the category which is not controlled. And this is why this happened? Actually, because the guideline confuses us. And this is the problem. If you look here, you will find that the guideline confuses us. Because why? They give us before something called optimal, normal, high normal, and all of this, have been changed recently, but it is confusing. What do you mean by optimal? There is nothing called optimal cancer and pre-cancer and this thing. So they confuse us by the guideline. So we'll find that the optimal is the best. And then you remember just a few years ago, there was the difference between European society and the American. The Americans say 130, European society said, no, don't use 130, use 140. And it seems now they regret what they said. So this is advice recommendation that they changed the guideline. This was 2018. They said optimal, normal, high normal. Now they said, sorry, don't believe us. We'll change for you. And they give us what is called this year, what is called elevated, non-elevated, elevated, and the high blood pressure. It's still confusing also. So look here, as I said, the problem is the number when you are treating, it is increasing. Why blood pressure is very bad? Because blood pressure is like the joker, affecting everything in your body. And of course, the most important is impotence also. It's very important. So what stops us from doing better? What stops us from doing better is the guideline. I will go very quickly to the guideline. First they said like this, then they changed like this, then they return back like this, and then they reduce like this. And then they give us what is called the Joint National Committee 8, and they said, sorry, we'll give you another guideline, and so on. So every year, they give us a different guideline with different number. So something very strange, because nobody knows what we should do. And then now, they came to us with 2024, they reduce everything. Okay, that's very good, we accept that. and this is the guideline. They said at night, you should not be more than 110 at night, okay? So if anybody more than 110 at night, he's hypertensive, should be treated. Okay, well and good, we accept that. Now they give us what is called the white-coated, okay, everybody know. Now they give us something called masked, which means that normal in the clinic, high at home. And this is, the explanation was very strange. They said because the patient, when came to the clinic, he feel comfortable in front of the doctor, so his blood pressure drop. When he go home, he feel uncomfortable, so his blood pressure raise up. This is one of the explanation of masked hypertension. So why controlled still? Because three reasons. The patient himself, because the patient, he said, awareness, education, compliance, multiple pathology, financial. There is a lot of obstacle for the patient himself. But the most important obstacle is no symptoms. The patient don't understand. And then we'll go to the physician. The problem is in the physician. We are the problem. Why? Look here, update with guideline, because you cannot read the guideline. It's very, very long. So the second thing is the time. The doctor has no time to sit with the patient. Number three, which is worry about patient compliance, because we don't know the patient compliant or not. Look for him. This is a control of hypertension, 146 over 94. The doctor said, good, it is enough, which is, of course, this is bad. Is this in the Middle East? No. Surprisingly, we find this. Look to this. This paper published in Europe will find that 84% of the doctor in Europe, when they find the patient is uncontrolled, they did not change the medication. They keep him uncontrolled. So the problem is the physician. The medication, yes, ineffective. Sometimes I find one, we know that all the guidelines say you have to be on at least 2 medications. But I find many patients stay for 20 years on 1 tablet, which is not correct. Costly, multiple pills, side effects. Now I will show you this Mr. Mahmoud. Mr. Mahmoud, this is a true case. He is 56. He came with all the risk factor and blood pressure 147 over 82. Have been seen many doctors. All of them did not give him medication because he's not complain. And then we find that 80% of hypertensive patients, they have multiple risk factors. You cannot find someone with only hypertension. And we'll find that the presence of diabetes by itself increases the blood pressure. I want you to look to this very important slide. This is someone who is 50 years of age and he have a lot of risk factors. If blood pressure 120, his risk will be 8% over the next 4 years by Framingham. Let me to make his age increase from 50 to 55. With the same blood pressure, his risk increased to 19%. So the age by itself play a major role. Let me to increase his blood pressure from 120 to 147. His risk will be 73%. You imagine how much the risk will be changed just by increasing the blood pressure to a very low number. So to conclude this Mr. Mahmoud, we told him take the medication. He refused to take. So why? Mr. Mahmoud is obese, smoker. Blood pressure they told him it's okay, 147, 82. His bad luck, we said drug don't work in patient who don't take it. So he will never take the medication. He came after 2 years with myocardial infarction. And after that, he started to take the medication. The objective of antihypertensive is to reduce the risk. So I think that I hope that you didn't do like this. When you came, you was confused. Now, after my talk, you became more confused. Thank you very much.